गुड मर्निङ एभ्रिवान वेलकम छ यहाँहरूलाई मेडिकल विथ सन्जुमा। आज हामी हेर्नेछौँ क्वेसन 426 देखि। Amniocentesis should not be performed during first 3 months of pregnancy. Why? Option A, there are more chance of infection. Option B, there is not enough amniotic fluid. Option C, chance of damage of a fetus. And option D, all of above. Amniotic fluid should not be performed during the first 3 months of the pregnancy because of there is a chance of a infection, no enough amniotic fluid, and maybe the damage of the fetus. So right answer option D, all of above. Question number 427. An amniocentesis test cannot be performed before 14 weeks of gestation because option A, fetal heartbeat is hard. Option B, the fetus is not mature. Option C, amniotic fluid is not enough. And option D, the genetic result may not be accurate. Amniotic fluid is not enough. Option C is right answer. Question number 428. Yearly amniocentesis is done in which period of pregnancy? Option A, 6 to 10 weeks. Option B, 11 to 15 weeks. Option C, 16 to 18 weeks. And option D, 9 to 11 weeks. Yearly amniocentesis is done in 11 to 15 weeks of a pregnancy. Option B is right answer. Question number 429. Amniocentesis is done to detect all fetal abnormalities except option A, Down syndrome, option B, open neural tube defect, option C, lecithin sphagmomyelin ratio, and option D, mental retardation. Mental retardation को लागि चाहिँ गरिदैन amniocentesis. So the right answer option D. Question number 430. While preparing a pregnant woman for amniocentesis, the nurse should option A, prepare her for IV anesthesia. Option B, instruct her to drink 1 liter of water. Option C, instruct her to void. And option D, place her in a left lateral position. Before performing amniocentesis, instruct pregnant mother to void. Option C is right answer. Question number 431. High level of alpha fetoprotein is diagnostic of option A, cirrhosis of liver, option B, Wilson disease, option C, hematoma, and option D, obstructive jaundice. Option C is the right answer. High level of alpha fetoprotein is diagnostic of a hepatoma and low level of alpha fetoprotein हुन्छ Down syndrome मा. High level of alpha fetoprotein hematoma मा and low level of alpha fetoprotein Down syndrome मा. Question number 432. A 36 years old multigravida who is at a 14 weeks gestation is scheduled for an alpha fetoprotein test. The alpha fetoprotein test is an indicator of option A, GI defect, option B, neural tube defect, option C, renal defect, and option D, cardiac anomalies. Neural tube defect, option B is right answer. Question number 433. Maternal serum alpha fetoprotein is elevated in all of the following except option A, multiple pregnancy, option B, open neural tube defect, option C, RH isoimmunization, and option D, Down syndrome. अल्फा फिटोप्रोटिनको लेभल सबैमा हाई हुन्छ, कुनमा हुँदैन? मल्टिपल प्रेग्नेन्सी, ओपन न्युरल ट्युब डिफेक्ट, आरएच आइसोइम्युनाइजेसनमा मेटर्नल सेरम अल्फा फिटोप्रोटिनको लेभल हाई हुन्छ तर डाउन सिन्ड्रोममा लो हुन्छ अथवा ट्राइसोमी पनि भन्छ यसलाई, यसमा लो हुन्छ. अप्सन डी इज राइट आन्सर. क्वेशन नम्बर 434. What not should answer if the mother asks, what does it mean if her maternal serum alpha fetoprotein is 35 ng per ml? Option A, it is abnormal. Option B, it is not clear. Option C, 35 mg per ml indicate chromosomal aberration. Option D, 35 mg per ml indicate neural tube defect. It is abnormal. 35 ng per ml is abnormal. यो 35 एनजे पर एमएल नर्मल हुन्छ कुन केसमा मेल एन्ड नन प्रेग्नेन्ट फिमेलमा नर्मल हुन्छ मेल एन्ड नन प्रेग्नेन्ट फिमेलमा अल्फा फिटोप्रोटिनको लेभल हुन्छ 0 देखि लिएर 40 एनजे पर एमएल सम्म हुन्छ प्रेग्नेन्सीमा 15 टु 20 विक्स अफ प्रेग्नेन्सीमा 10 टु 150 एनजी पर एमएल हुन्छ सो यो एब्नर्मल भयो राइट आन्सर अप्सन ए Question number 435. Which of the following is an indication for oxytocin challenge test? Option A, previous abruptive placenta. Option B, placenta previa. Option C, premature onset of labor. And option D, pregnancy more than 40 weeks. Pregnancy more than 40 weeks is the right answer. Previous abruptive placenta चाहिँ हिस्ट्री छ भने त्यसमा त अक्सिटोसिन च्यालेन्ज टेस्ट गरिँदैन प्लेसेन्टा प्रिभियामा पनि गरिँदैन प्रिमेचर अनसेट अफ लेबर छ भने त्यसमा पनि गरिँदैन प्रेग्नेन्सी मोर देन 40 विक्स छ भने चाहिँ अक्सिटोसिन च्यालेन्ज टेस्ट गर्छ अप्सन डी इज राइट आन्सर क्वेसन नम्बर 436 A contraction stress test is scheduled for the pregnant client and the client asks the nurse about the test. The nurse tells the client that option A, small amount of oxytocin, pitocin are administered during internal fetal monitor to stimulate uterine contraction. Option B, an external fetal monitor is attached and the woman ambulate on a treadmill until contraction begins. Option C, the uterus is stimulated to contract by the use of a small amount of oxytocin, pitocin, or by the nipple stimulation. Option D, uterine contractions are stimulated by Leopold's maneuver. The uterus is stimulated to contract by the use of a small amount of oxytocin, pitocin, or by the nipple stimulation. Is the right answer. Option C. Question number 437. An antenatal mother with a positive contraction stress test, which of the following can be suspected? Option A, neural tube defect. Option B, preeclampsia. Option C, placenta previa. And option D, uteroplacental insufficiency. Option D, uteroplacental insufficiency is the right answer. Question number 348. Non-stress test is reactive into a pregnant woman. Priority actions of the nurse is option A, suggest OCT. Option B, no need of any action since baby is healthy. Option C, report mother. And option D, none of above. No need of take any action since baby is healthy. Option B is right answer. Question number 439. Non-stress test is said to be normal if there is option A, 2 or more FHR accelerations during a 20-minute period. Option B, 2 or more FHR acceleration in 40 minutes period. Option C, no declaration during a 40 minutes observation. Option D, no acceleration during a 40 minutes observation. Non-stress test is said to be normal if there is a 2 or more FHR acceleration during 20-minute period. Option A is the right answer. Question number 440. A non-stress test is prescribed for a pregnant mother, and a nurse informs the woman about the procedure. The nurse tells that option A, the test is an invasive procedure and required diet and informed consent. B, sign. Option B, the test will take about 2 hours and will require close monitoring for 2 hours after procedure is completed. Option C, an ultrasound transducer that records fetal heart activity is secured over the abdominal where the fetal heart sound is heard most clearly. And option D, fetus is challenged or stressed by uterine contraction to obtain necessary information. Right answer is option C. Next question in next video. Thank you so much.